In this video, we're going to break down the Next Gen NCLEX, or the NGN. We'll talk about the new format of it, the types of questions there are, what's changed, and more importantly, what is staying the same. Let's dive in. Now, before we dive in, I want to get this out on the table. If you are currently in nursing school, don't let yourself get sucked into the drama about the NGN. Just because the NCLEX changed doesn't mean you're going to fail it. You can figure it out, my friend, and you will pass, okay? Don't let your brain spiral into the drama that's all surrounding it. Instead, trust that you are capable and you can do this because you can. All right, so now that that's out of the way, let's dive into the NGN and what it all means. Let's start with one thing that isn't changing. And friend, this one is a pretty big deal. The actual nursing content did not change. Everything you're learning about in nursing school still applies, okay? So the pathophysiology of pneumonia or of hypertension or of cardiomyopathy, it's all still the same. It didn't all of a sudden just change overnight from what you learned in nursing school and now you need to learn it all over again. No. The nursing content did not change. It's just the types of questions that changed. They just want to make sure that you are able to safely provide quality care to your patients as a nurse, right? That's it. So don't worry. All of the work that you've done up until this point, it matters because the content you're tested on has not changed. So let's dive into what has changed with the NGN. One of the most talked about changes is the increase in the amount of options in select all that apply questions, or what they're now calling extended multiple response questions. Now, here's the good news. You can get partial credit now with these SATA questions. That is a game changer, my friend, especially if you are following the right strategies for how to answer those select all that apply questions. If you don't know what those are, I'll get to that in a minute, so hang with me, okay? So if you pick some of the right answers, but not all of them, you still will be given partial credit. Now, don't go thinking that you can choose all of the answers in a SATA question and call it good. It does not work that way. They use what's called plus minus scoring, which means that you'll get 1 point for correct answers, but you'll actually lose points for incorrect answers. So you want to make sure that you're paying attention and that you're still critically thinking through the question, right? And doing your best to answer them correctly. Another one of the main shifts of the Next Gen NCLEX is that there will be a much bigger emphasis on case study content and real life scenarios. And because of that, a bigger emphasis on applying what you know through critical thinking. This is where some of the new types of questions are now coming into play. Things like an extended drag and drop questions, or clause drop down questions, clause, I don't know how they say that, highlighting questions, and the matrix or the grid questions. These are all testing you on more case study like scenarios, making sure that you are able to apply what you have learned into a real life, safe, and high quality nursing care situation. Now, the good news about this is that if you have been studying all along and following our study frameworks like the DRC critical thinking model and the 4 core method and the Farm4 strategy, everything we teach inside the NursingSOS membership community, you are already critically thinking about the concepts and you will be ready to fly through these NGN questions, okay? So as I mentioned before, the nursing content is not changing. That's all staying the same. So as long as you are studying in a way that is going to foster that critical thinking, you are good to go. Now, before I forget, I have a free critical thinking cheat sheet for you so that you can use it as you study. Now, I'll put the link down below in the description for that, so you can snag that after you watch this video. So the nursing content hasn't changed. What you are learning about in nursing school, the concepts are what will be on the exam. That part is not changing. Nursing content is nursing content, my friend. What you are learning in nursing school will prepare you for the NGN. That's so important for you to know. Don't freak out, okay? So how they assess what you have learned and how they ask the questions, now that is changing. So doing the practice questions will be the most beneficial thing to help you prepare for the NGN besides learning the content. You want to dive deeper, Don't just glaze the surface of the content. Learn it, apply it, connect it, and critically think about it, okay? These new formats of questions are meant to mimic real scenarios. You will be given a lot more information about the patient and their situation. You might be given their medical record to click through so you can look through their health history, their vital signs, the nursing notes, and their lab results, just like you would in real life. Then the question will ask you to prioritize your actions or something like that. This is all real life stuff. Critical thinking, connecting the dots, putting the pieces together, and planning ahead. Now, the good news is if you're critically thinking, like we said, you're likely doing this already. It will just be another format for you to prove that you understand how to be a capable nurse who delivers high quality care. Now, I wanted to mention this too because I've gotten this question a lot lately. Will the resources inside the NursingSOS membership community help me prepare for the NGN? And the answer is yes. Absolutely, yes, my friend. Everything we do inside the NMC will help you connect concepts together and critically think, which is exactly what the NGN will be testing you on. So if you're feeling a little overwhelmed, trying to make sure that you are studying properly and learning the content that is going to be the most important for the NGN, the NursingSOS membership community is what you need to really give you that confidence boost that you're learning the right things. Now, another thing I wanted to make sure to mention, and this is really, really good news, is that you no longer have to memorize normal ranges for lab values. They will be given to you on the Next Gen NCLEX. I don't know about you, but lab values were always one of my weak points and really something that I would always kind of mix up in my brain when it came to exams in nursing school. So this would have been a huge help for me. So you will no longer have to memorize the lab value ranges. But that being said, check with your nursing program because they might not be caught up quite yet with the NGN. You may still need to memorize the lab values for your lecture exams. If your program utilizes test banks like ATI or HESI or Kaplan, they should be caught up by now to the NGN. They should give them to you, but double check just to make sure that you don't miss anything on your actual nursing course exam. But just know that when you go take the NCLEX, the NGN, the lab values will be given to you on those tests, the normal ranges for them. So you don't have to memorize all of those normal ranges. Now, as you are studying for the NGN, make sure that you are focusing your studying on the topics that you don't know well enough, okay? Focus on your weaker areas and the topics that you struggle with. It is so easy to get stuck in the comfortable space of reviewing what you already know and what you feel confident in. So make sure that you're focusing on your weaker areas and trying to strengthen those before you go take the NGN. And there's a lot of testing strategies that you can use to answer NCLEX questions correctly, and I'm gonna break them down in this video for you right here, including how to answer SATA questions, okay? So be sure to check that video out next. And as always, my friend, go become the nurse that God created only you to be, and I will see you over there in that next video.